Ms. Burke.
Thank you, Mr. Chair and members. Let me start by accepting the amendments outlined in the analysis. I'd like to thank you and your staff for helping me with the language, so I appreciate that. AB 2372 improves access to care for Californians living with HIV by requiring health plans to include HIV specialists within their network and providing a pathway for HIV specialists to serve as primary care providers for their patients. While current law requires plans and their networks to include access to medically required specialists, what we found is that the plans are relying upon infectious disease specialists to serve their beneficiaries with HIV. Certainly, every HIV specialist is an infectious disease specialist, but not every infectious disease specialist has a certification and training to provide comprehensive care to people living with AIDS. We need provider networks that can meet the needs of beneficiaries, and we should allow HIV specialists to serve as primary care providers for their patients. With this bill, we can deliver better, more coordinated care for Californians living with HIV. I am working with stakeholders to include the plans to find some common ground, and I respectfully request your aye vote.
Thank you. Testimony and support.
Mr. Chair and members, Rand Martin on behalf of the sponsor of the AIDS Healthcare Foundation. I'll be very brief. The Assembly member has outlined the situation very well. I just want to point out that AHF is one of the largest private nonprofit providers of care and treatment of people with HIV in the state of California, has experienced on the ground concerns about having sufficient number of HIV specialists, which is a certification discipline in the state of California, to be available to people with HIV. We want to make sure that there are more available. We want to make sure that those HIV specialists are able to provide all care to their patients, including those services that a PCP would provide, and this bill would allow for both those things to happen. Thank you.
Thank you. Additional testimony and support. Hearing and seeing none, let me move to testimony in opposition. Please proceed.
Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies. I'd first like to thank the author and sponsor. We have had some very productive conversations, and I think there's a part of this bill that we really probably can work out, which is the designation of a HIV specialist as a PCP. I appreciate the amendments that the author has taken and that were offered by the staff as a part of sort of creating some rubric around how that designation would happen. Unfortunately, the second part with respect to giving a favorable status, so to speak, to HIV specialists as a part of our network adequacy requirements. These are sub-specialists, and I think our concern is that we're not really sure how this would potentially affect our very rigorous network adequacy standards. We currently have to require for specialists have to meet a max travel time of 60 minutes, a max travel distance of 30 miles. For non-urgent appointments, we have to meet a 15-day requirement for an appointment upon request. We're just not sure how many of these HIV specialists exist, where they exist in the state of California, and whether or not we would be potentially placing our networks in jeopardy of not being meeting the network adequacy requirements, and whether or not that would invalidate our networks. So, I mean, that is a huge piece that we would like to continue to talk about and through with the author if the bill moves forward today. But unfortunately, as it stands today, we are opposed.
Okay. Additional testimony in opposition.
Jennifer Alley with the California Association of Health Plans, and I too would like to thank the author, her staff, and the sponsors for their hard work on addressing our opposition and our concerns with the bill. I'm currently waiting for feedback on my members regarding the impact of the HIV specialists would cause for their network adequacy requirements, and we look forward to continue our work with the author and sponsor. Thank you.
Thank you. Additional testimony in opposition. Please.
Yeah, John Winger on behalf of America's Health Insurance Plans, also in opposition, but would look forward to working with the author's office and the sponsor on the bill.
Thank you. At this time, let me turn it to members on the dais for questions. Mr. Gatto, please.
So are these issues that can be worked out, or is this something that appears that it's not something that can be worked out?
No, I think we're working together to see how we'll best work this out so that both the beneficiaries and the plans are able to get what they need.
Okay, thank you. Additional questions? Mr. Chavez, please.
I'm very intrigued by your bill. How many HIV specialists are in the state?
Ms. Chavez, I'm sorry, I don't know the answer. There was a very robust network when the federal government, through the Ryan White CARE Act, was paying for most of the care that was not provided under Medi-Cal. That network has dwindled some since the Affordable Care Act came into being, so I'm not exactly sure what the number is today.
And do you have a feeling for where they are regionally? Are they more like it, let's say, in Los Angeles than they would be
They are
Fresno
mostly
and Bakersfield? Or?
Sorry, they're mostly based in large urban areas, but they are scattered across the state where there has been a higher number of HIV cases historically.
So do the insurance companies, is there a concern that we're not going to be able to provide the care that we want, or you're not going to be able to get them to provide the care? Because I know we divided the state up in these regions and covered California, so is that your concern?
Yeah, I think our concern is sort of twofold. As you create sort of a favored status for this subcategory of specialists, which is unique, when you look at the regulations, they don't really carve out specific specialists or subcategories. They just say we have to have an adequate number of specialists to meet the requirements and the time and distance standards. I think what our concern would be is that if there aren't a sufficient number of HIV specialists, certainly we wouldn't meet those requirements and therefore would have to request some sort of special dispensation because they don't exist in those regional areas. I mean, that does happen at times, but this would also give sort of preferential treatment and create an imbalance in the contracting negotiations, because if there is a shorter or smaller number of these type of specialists, certainly, and we have to have an adequate number of them to meet these time and distance standards, they would have sort of there would be an imbalance in those negotiations for contracting for that preferential treatment.
An imbalance for?
So if you have a shortage in the amount of or the number of specialists that you have, but you have to have those specialists in your network, when you're negotiating for terms and conditions to include them in your network, it sort of creates an imbalance in that discussion.
Would that run up costs, supply and demand?
Yeah, that would certainly address costs.
And we don't have any testimony from infectious disease specialists, or what are they saying about this?
I don't have feedback from infectious disease specialists, but some of our plans do have infectious disease specialists in their network that currently treat HIV patients or patients with HIV.
Okay. Thank you.
Thank you. Additional questions from members on the dais? Hearing and seeing none, Ms. Burke, thank you for taking the committee amendments. I know when we're looking at the specialists that they still have to be licensed and have their certification as well, whether that's a licensed nurse practitioner or a physician. With that, would you like to close?
Yes. So there are ways to address some of the issues. We have no desire to have the networks or the health plans be out of compliance. However, it is tremendously important for those who are suffering from HIV to have the proper infectious disease specialists at their disposal. With that, I request an aye vote.
Thank you. Members, this is file item number 13, due pass as amended to Health Committee. Madam Secretary, please call the roll. It has a motion by Mr. Gatto, second by Mr. Daly.
Salas.
Aye.
Salas, aye. Bro.
Aye.
Bro, aye. Baker.
Aye.
Baker, aye. Bloom. Campos. Campos, aye. Chavez. Chavez not voting. Daly. Dodd. Dodd, aye. Eggman. Gatto. Gatto, aye. Gomez. Holden. Holden, aye. Jones. Mullen. Mullen, aye. Ting. Wood. 8-0 measures on call.
Okay, that measures on call on an 8-0 vote. Thank you. Now we are waiting, members, for one final author for file item number 4, Assembly 1859 by Mr. Gallagher. At this time, while we are waiting for our last author, let's go ahead and go through each of the measures so members can add on. So let's start with item number 1 and work our way down. Madam Secretary, call the absent members. Assembly Bill 1575.
Bloom. Campos. Number 1. Campos, aye. Daly. Dodd. Dodd, aye. Gomez. Holden. Holden, aye. Jones. Ting.
Okay.
10. Measures out 10 to 0.
That measures out 10 to 0. Let's move to file item number 2, AB 1751 by Assemblymember Lowe. Call the absent members.
Bloom. Dodd. Dodd, aye. Gomez. Jones. Ting. Wood. 10 to 0. Measures
Okay.
out.
That measures out 10 to 0. Let's move to file item, well, let's call the absent members for file item number 3, AB 1807.
Bloom. Daly. Dodd. Dodd, aye. Gomez. Ting. 12 to 0. Measures
Okay.
out.
That measure has 12 votes. That's out. Let's move to file item number 5, AB 2025. This is AB 2025. Gonzalez. Call the absent members.
Baker. This is
AB
on call.
2025 by Ms. Gonzalez.
Baker. Baker, aye. Bloom. Eggman. Gomez. Holden. Holden, aye. Mullen. Mullen, aye. Ting. 10 to 0. Measures out.
Okay, that measures out 10 to 0. Let's move to file item number 6, AB 2066 by Assemblymember Lackey. Call the absent members.
Bloom. Daly. Dodd. Dodd, aye. Gomez. Ting. 11 to 0.
Okay,
Measures
that
out.
measure has 11 votes. That measure is out.
Consent calendar.
Let's move on to consent calendar. Madam Secretary, call the absent members.
Bloom. Daly. Dodd. Dodd, aye. Gomez. Ting. Consent
Okay,
calendar.
consent calendar is out, 12 to 0. At this time, let's go ahead and move forward to our final author, Mr. Gallagher. This is file item number 4, AB 1859.
And my apologies, Mr. Chairman. I've been running around between 2 different committees and presenting in other committees. Proud to present AB 1859, which would make several clarifying changes to codes governing the activities of repossessors. I will start by accepting all of the committee's proposed amendments. AB 59 will help streamline the inventory process, clean up provisions governing the release of collateral, and clarify definitions in this code. And I would respectfully request your aye vote. I have
Thank
two
you.
witnesses here
Bill's
to testify in support today, Jerry Desmond and Joey Collins.
Thank you. That bill's been moved by Ms. Baker. Please proceed with testimony and support.
Joe Collins from the California Association of Licensed Repossessors, here to answer any technical questions.
Thank you. Additional testimony and support.
Jerry Desmond on behalf of CalR, also here to answer any technical questions and support.
Okay, thank you. Let me ask for additional testimony and support. Hearing and seeing none, let me move to testimony in opposition. Hearing and seeing none, let me turn it to members on the dais for questions. Hearing and seeing none, let me thank the author for accepting the committee's amendments, which help strengthen the bill. Mr. Gallagher, would you like to close? All right, thank you. This is members file item number 4, AB 1859. This is due pass as amended to appropriations. Madam Secretary, call the roll.
I need a second.
We need a second on that by Mr. Gatto. Madam Secretary, call the roll.
Salas.
Aye.
Salas, aye. Bro. Baker. Baker, aye. Bloom. Campos. Campos, aye. Chavez. Chavez, aye. Daly. Dodd. Dodd, aye. Eggman. Gatto. Gatto, aye. Gomez. Gomez, aye. Holden. Holden, aye. Jones. Jones, aye. Mullen. Mullen, aye. Ting. Wood. 10-0 measures out.
Okay, that measure is out, 10-0. Thank you.
Thank you.
Okay, let's continue to go down the agenda list, call all the absent members. Let's go to file item number 12. Madam Secretary, call the absent members.
Salas.
Salas, aye.
Salas, aye. Bloom. Daly. Dodd. Dodd, aye. Gomez. Gomez, aye. Ting. 13-0 measures
Okay,
out.
that measures out, 13-0. That is going to appropriations. File item number 13, AB 2372 by Ms. Burke. This is a due pass as amended to health.
Bloom. Daly. Eggman. Gomez. Gomez, aye. Jones.
This is 13. File item 13, AB 2372.
Jones, aye. Ting. Wood. 10-0 measures out.
Okay. That measure has 10 votes. That measure is out. Let's move to file item number 14, AB 2581 by Assemblymember Medina. This is due pass as amended to appropriations. Madam Secretary, call the absent members.
Bloom. Daly. Dodd. Dodd, aye. Gomez. Gomez, aye. Ting. Wood. 11-0 measures out.
That measures out, 11-0. Let's move to file item number 15, AB 2632 by Ms. Olson. This is due pass as amended to appropriations.
Bloom. Campos. Campos, aye. Daly. Dodd. Dodd, aye. Gomez. Gomez, aye. Holden. Holden, aye. Mullen. Mullen, aye. Ting. Wood. 12-0 measures
Okay,
out.
that measures out, 12-0. Let's move to file item number 16, AB 2679 by Mr. Cooley. This is due pass to appropriations. So, do we have a motion on this bill? Motion by Mr. Gatto, second by Mr. Wood. Let's go ahead and call the roll.
Salas.
Salas, aye.
Salas, aye. Bro. Baker. Baker, aye. Bloom. Campos. Campos, aye. Chavez. Chavez, aye. Daly. Dodd. Dodd, aye. Eggman. Gatto. Gatto, aye. Gomez. Gomez, aye. Holden. Holden, aye. Jones. Jones, aye. Mullen. Mullen, aye. Ting. Ting, aye. Wood. Wood, aye. 12-0 measures out.
Okay, that measure is out on a 12-0 vote. Let's move to file item number 17, AB 2699 by Ms. Gonzalez. I believe that motion was by Ms. Campos, seconded by the chair. Madam Secretary, call the absent members.
Bloom. Campos. Campos, aye. Daly. Dodd. Dodd, aye. Gomez. Gomez, aye. Holden. Holden, aye. Mullen. Mullen, aye. Ting. Ting, aye. 13-0.
Okay, that measure was due pass as amended to judiciary. It has 13 votes sufficient to move out of this committee. Let's move to file item number 18, AB 2790 by Mr. Nazarian. This is due pass as amended to transportation. Madam Secretary, I do believe we need a motion Do I have a motion to move Mr. Nazarian's bill?
Second.
All right, moved by Mr. Wood, seconded by Mr. Ting. Madam Secretary, call the roll.
Salas,
Aye.
Salas, aye. Bro,
Aye.
Bro, aye. Baker, Bloom, Campos, Campos, aye. Chavez, Chavez, aye. Daly, Dodd, Dodd, aye. Eggman, Gatto, Gatto, no. Gomez, Gomez, aye. Holden, Holden, aye. Jones, Jones, no. Mullen, Mullen, aye. Ting, Ting, aye. Wood, Wood, aye. Ten to 2.
Okay, that measure is out on a 10-2 vote thus far. I believe that is all of our agenda items. So we will hold the roll open for another. Do we have any items on call? No, I think everything's got sufficient amount of votes.
Yeah.
So we will go through the measures for additional members I want to add on at this time. Thank you, members. I believe we finished quicker this time than last week, so we will move forward. We will hold the roll open. Sergeants, if you could call the other members that have yet to vote, let them know that this committee is getting ready to shut down if they'd like to cast their vote. Thank you.